Friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. You can also visit the playlist. In the playlist I have provided all the topics in the systematic order. We were discussing about nephrotic syndrome. In the last class we have seen up to the primary nephrotic syndrome and four important types of primary nephrotic syndrome, that is minimum change nephrotic disease, focal glomerulosegmental sclerosis, membrane glomerulonephritis, membranous proliferative glomerulonephritis, and rapidly progressive glomerulonephritis. Especially the pediatric population is concerned, the first one is very common and the second one is more common in the adults, and the later three are not so common, they are uncommon. Today we will discuss about secondary nephrotic syndrome. That means a nephrotic syndrome which is caused by a cause other than the kidney or the renal system. So this may happens because of the disease like diabetic nephropathy. Diabetes is the root cause and that is causing some problem in the nephron that may also lead to nephrotic syndrome. Systemic lupus erythematosus, one of the autoimmune disorders, so that may also lead to this particular disease. Another is a sarcoidosis. Similarly, syphilis may affect, and hepatitis B and HIV, amyloidosis, vasculitis, and cancers like myeloma, etc. So they may also lead to this particular problem. These are all comes under the purview of secondary nephrotic syndrome. Another set is congenital nephrotic syndrome. This is also considered as secondary nephrotic syndrome only. Of course, the congenital nephrotic syndrome is very rare. Okay, so where the cause is genetic. Sometimes because of some genetic cause also nephrotic syndrome may be there, but very rarest of rare. And it's called as a Finnish nephrotic syndrome. It is called as Finnish nephrotic syndrome. But most common is drugs. Drugs may also lead to secondary nephrotic syndrome, especially the gold salts, penicillin, captopril, etc. are some of the common drugs which may lead to secondary nephrotic syndrome because of their adverse effects. So now we will focus more on primary nephrotic syndrome. What are the incidents of primary nephrotic syndrome? This is the most common among the primary nephrotic syndrome. As I mentioned earlier, it is a minimal change nephrotic syndrome. Now if you see the primary nephrotic syndrome, incidence wise 90% of the children will have problem of this primary nephrotic syndrome. Okay, so this primary nephrotic syndrome otherwise is also called as idiopathic nephrotic syndrome. Okay, not all the nephrotic syndromes are called as idiopathic nephrotic syndrome, only the primary types, which is 90% common, so that is called as idiopathic. Okay, out of all these primary nephrotic syndrome chances, about 85% is having first type, that is minimal change nephrotic syndrome. So therefore we are telling in children among the primary nephrotic syndrome, the most common is a minimal change nephrotic syndrome, 85%. And rest of the 5% is mesangial proliferation related nephrotic syndrome, and about 10% is because of the focal sclerosis, the other types, glomerulofocal sclerosis, etc. Okay, so now we come to know that most common type of primary nephrotic syndrome is a minimal change nephrotic syndrome, which is very commonly seen in pediatric practice. Okay, now this minimal change nephrotic syndrome is very common in those children who will have high incidence of recurrent respiratory tract infections, especially the pharyngitis, laryngitis, that is more towards the lower respiratory tract infections, maybe because of the bacteria. So those children who had the history of recurrent streptococcal bacterial infections, okay, or even sometimes other viral infections leading to pharyngitis and laryngitis, etc. If it is very recurrent, so that is one of the most common triggering factor for this minimal change nephrotic syndrome. So far, what we have understood, okay, especially the bacterial streptococcal group of infections more than the virus. Virus may exaggerate an already existing nephrotic syndrome patient. That means a patient is having nephrotic syndrome, he is taking treatment, but one attack of viral infection may further aggravate the situation. Okay, so but when you see as a root cause, okay, one of the triggering factor, so if you see that is a recurrent respiratory infection because of the bacteria, especially streptococcus. Now if you look into the pathophysiology, pathophysiology. So this explained here. So this pathophysiology we will look in the next class. We'll discuss the pathophysiology in detail in the next class. Thank you very much.